Homosexuality. Introduction. This study session focuses on the practice of having sexual intercourse with members of the same sex. In males, these persons are referred to as homosexuals. In females, they are known as lesbians. At the end of this study session, you should be able to Study Session 8. Homosexuality. Introduction. This study session focuses on the practice of having sexual intercourse with members of the same sex. In males, these persons are referred to as homosexuals. In females, they are known as lesbians. At the end of this study session, you should be able to discuss the concept of homosexuality and highlight the determinants of homosexuality. Features of homosexuality. Homosexuality denotes erotic thoughts and feelings towards a person of the same sex, as well as any associated sexual behavior. The expression of this behavior varies with age and circumstances. It is more likely to be expressed when heterosexual behavior is unavailable. For example, in prisons. Same-sex behavior is common in both male and females. In males, it is homosexuality. In females, it is known as lesbianism. Homosexuality in men involves physical intercourse, which includes oral genital contact, mutual masturbation, and less often, anal intercourse. The partners usually change roles in these acts, but with some couples, one partner is always passive and the other is always active. The relationship does not last, and some homosexual men exclusively experience strong feelings of identity with other homosexuals and seek their company, most often in clubs or bars. Some adopt feminine mannerism and dress in women's clothes to attract others. Most homosexual men have a way of life like that of a single heterosexual man. However, few of them prefer work and leisure activities that would usually be undertaken by a woman. Most are contented as heterosexual men and have a stable relationship with their individual partners. Homosexual men vary in personality as much as heterosexual men. In homosexual men, as in heterosexual men, disorder of personality is more likely to lead to difficulty with other people or with the law, and more likely to lead to referral to a psychiatrist or clinical psychology. As regards same-sex women, tender feelings and social activities are an important source of satisfaction. Physical intercourse between them includes caressing, breast stimulation, mutual masturbation, and oral genital contact, otherwise known as cunnilingus. A majority of them practice full body contact with genital friction or pressure, known as tribadism. They may also engage in the use of a vibrator or artificial penis, that is, dildo. Active and passive roles are usually exchanged, although one partner may habitually take the active role. Social behavior is usually like that of a heterosexual woman, although some seek work and leisure activities which are more often than not associated with men. A few of them dress and behave in masculine way. Most of them also engage in heterosexual relationships at some time, even though they may obtain little satisfaction from them, and some may marry. As a group, they are less promiscuous than homosexual men and are less likely to seek transient sexual relationships in bars and other places. They are more likely to form lasting relationships and are less likely to suffer loneliness and depression in middle life. Many of them may have personality problems underlying their same-sex tendencies. Determinants of homosexuality. Genetic causes of abnormality of sex chromosomes have been imputed as responsible for homosexuality or lesbianism. Also, certain hormonal theories and neuroanatomical differences have been imputed. As regards psychological causes, compared with heterosexual men and women, homosexual men and lesbian women have more often experienced a poor relationship with or prolonged absence of the father figure in the family. Other psychoanalysts have also reported that mothers of homosexual men are overprotective and unduly intimate. Some have also suggested that female lesbianism results from failure to resolve unduly close relationships which the patient eyed during early childhood, with the result that intimate involvement with men is frightening and women become the preferred object of love. In a study of homosexuals, Friedman, Kaplan, Sadok in 1976 discovered that lesbian women reported a poor relationship with both mother and father. Also, a quarter of the lesbian women have parents who are divorced, compared with 5% in control. Heterosexual development may be impeded by repressive family attitudes towards sex, by frightening early heterosexual experiences, or by lack of self-confidence with the opposite sex. Social determinants of homosexuality vary in acceptance in different societies and may be caused by lack of sexual outlets and subcultural attitudes. Study session summary. In this study session, we discussed the problems of sexuality and gender identity. Specifically, we examined the problem of homosexuality among men and lesbianism among women. We also highlighted certain determinants of homosexuality in men and lesbianism in women. End of study session 8. Thanks for listening.